The objective of the Ferrara Ring, today world-renowned, is to give to both doctors and patients an alternative in the treatment of keratoconus. Instrumentation. Sinskey hook. Transfer. Double marker. Kramer fixation forceps. Ferrara diamond knife. Pre-delaminator. Suarez spreader. Left side Ferrara spatula. Right side Ferrara spatula. Bicalho guide. Modified McPherson forceps. First step, demarcation of the optical center. Instrumentation, Sinskey hook. Have the patient look directly at the light filament of the microscope. Using the Sinskey tool, mark the point of reflection on the cornea. Consider the optical center and not the center of the pupil. Second step, demarcation of the incision locale and optical zone. Instrumentation, transfer, and double marker. Centered on the point determined in the first step, mark the most curved meridian of the cornea and the optical zone where the Ferrara ring is to be implanted. The incision should be made on the most curved meridian of the cornea. Keep the cornea dry during surgery. Third step, incision. Instrumentation, Ferrara diamond knife, and Kramer fixation forceps. Calibrate the knife to 0 microns. Confirm the blade calibration using the microscope, ensuring the correct calibration of the knife. Calibrate the knife to a depth of 80% of the ultrasonic pachymetry at the locale of the incision. Immobilize the eye using the Kramer fixation forceps, which should be fixed near the edge of the cornea. Proceed with the incision. Fourth step, pre-delamination. Instrumentation, pre-delaminator. Insert the pre-delaminator until reaching the bottom of the incision. With a slight rotating movement to the left or right, open a small pocket in the intended direction of the tunnel. Fifth step, create pockets. Instrumentation, Suarez spreader. Introduce the tip of the Suarez spreader into the incision, widening with small movements the pocket created in step 4. For the implantation of the 2 segments, do this procedure in both directions. It's very important that the pocket be created at the proper depth. The ideal positioning of the Ferrara ring is directly related to and dependent upon this step. Sixth step, creating the tunnels. Instrumentation, Bicalho guide, and Ferrara right and left spatulas. Introduce the Bicalho guide vertically into the incision. Incline the guide into a vertical position such that it enters the tunnel approximately 3 millimeters. Introduce the Ferrara spatula beneath the guide, using the guide as a lift. remove the guide. To make the tunnel, hold the spatula between the finger and thumb. With rotating movements, maintain the spatula within the optical markers. Use the tip of the spatula as a reference to guide it correctly in making the tunnel. Tunnel until the 180-degree mark and return. Utilize the same procedure with the other spatula to create the opposite tunnel. Do not permit the spatula to incline, maintaining it flat. Do not force the spatula upward or downward. Seventh step, implanting the Ferrara rings. Instrumentation, Bicalho guide, and modified McPherson forceps and Sinskey hook. Remove the Ferrara ring from its case using the modified McPherson forceps. Place the ring over the eye, ensuring that the flat side of the ring is downward. Hold the ring with the McPherson forceps at 1/3 from the end to be implanted. Introduce the Bicalho guide approximately 3 millimeters inside the tunnel and maintain, introducing the ring into the tunnel beneath the guide. Remove the guide without releasing the ring. Using short movements, introduce the ring into the tunnel until only the tip and orifice remain exposed. Use the Sinskey hook in the orifice of the ring to push the ring into the tunnel. The ring should finally rest at least 1 millimeter of distance from the incision. Repeat this procedure for the implantation of both segments.